Bernie Sanders is introducing his Medicare for All bill. It seems that this complete government takeover of health care is becoming the litmus test for the liberal left. A majority of the Democrats in the House have already co-sponsored a similar piece of legislation. And while Bernie Sanders' slogan may be very popular, it's really the nuts and bolts and the details that matter the most. And that's what's it going to cost the American people in terms of money, in terms of time, and in terms of their freedom of choice when it comes to health care. In terms of money, the dollars, what we know is that the state of Vermont, Bernie Sanders' home state, had passed a similar plan for their state, and they had to eliminate it when they realized they would have to double the tax income to the state, double the taxes collected on the people of that state to pay for it because it was so financially expensive. In terms of the costs in time, they often talk about the British healthcare system as being the model for this. Well, the problems with the British healthcare system have gotten so bad that they're setting new records for waiting time. People in emergency rooms, those that have to wait longer than 12 hours, that's at new record highs. People waiting to just start routine care for chronic conditions, that's expanded to the point of the number of people having to wait over 18 weeks to start the treatment. And in terms of loss of freedom of choice to get the care that you need from a doctor that you choose, when you take a look at Britain compared to the United States, for a woman with breast cancer or a man with prostate cancer, if they have that situation in Britain, they'd rather come to the United States because the success rate of those treatments are so much better in the United States, not because our doctors are that much better, but because they actually can get care sooner here in the United States. And finally, with a program like so-called Medicare for All, what that means can be devastating to our seniors who are on Medicare now. That's a program that has challenges now in terms of patients getting to see doctors because the reimbursement rates are low. But for the integrity of that program for seniors, the Bernie Sanders approach of putting more and more people on it will undermine the ability of our current seniors to get the treatment that they need under Medicare.